Okay.
Just a second.
Working.
Okay.
Okay, let's start.
Bonjour Philippe, excusez-moi
Bonjour,
mon français, mais c'est un grand honneur et un grand plaisir de vous recevoir aujourd'hui sur notre chaîne YouTube de l'EA. C'est les laboratoires d'études archéologiques, les laboratoires du département d'histoire de l'Université fédérale de São Paulo, UNIFESP. L'EA est composé de deux groupes de recherche. Le METAF, c'est le Centre d'enseignement et recherche en archéologie et anthropologie médico-légale. Et le TDH, c'est le Territoire et droits de l'homme. Nous vous remercions beaucoup d'avoir accepté de présenter à notre public votre travail concernant les contributions des sciences médico-légales à l'histoire, archéologie et anthropologie. Ce sont sûrement des sujets d'actualité très pertinents pour les temps présents et surtout au Brésil. Claudia fera votre présentation en portugais pour notre public. Et bon, merci beaucoup d'être présent sur la chaîne Léa. Bienvenue au Brésil finalement, nous sommes très contents et bonne conférence à nous tous. Merci.
Merci.
Então, boa noite a todos. Eu quero agradecer ao público por estar aqui hoje. Nós temos um grande público do Brasil inteiro. Eu vou fazer uma rápida apresentação para vocês verem, né, quem é o nosso convidado. Ele tem um currículo imenso, a gente tem toda uma resumida, mas vocês verão realmente a importância desse nosso convidado. Philippe Charlier é doutor em Medicina e Letras, é antropólogo e arqueólogo, especialista em paleopatologia e Antropologia Forense. Até 2013, atuou no Departamento de Medicina Legal do Hospital Universitário Raymond Poincaré de Garches. Desde 2018, é diretor do Departamento de Pesquisa e Ensino do Musée do quai Branly, Jacques Chirac, onde desenvolve o uso de técnicas biomédicas e scanner, análises microscópicas e genéticas, não só para o estudo dos remanescentes humanos, mas também para a cultura material. Ele é membro do Laboratório de Antropologia, Arqueologia e Biologia da Universidade Paris-Saclay, da Fundação de Antropologia, Arqueologia e Biologia, do Instituto de France, da Sociedade de Geografia dos Exploradores Franceses, dos Africanistas e da História da Medicina. Possui uma vastíssima produção bibliográfica, entrevistas e vídeos, com mais de 25 títulos de livros e obras organizadas em parceria com outros especialistas. Participou de escavações e análises osteológicas de vários contextos arqueológicos e forenses, por exemplo, na Itália e na Grécia, e é conhecido como Indiana Jones dos cemitérios pela mídia francesa, com vários estudos sobre os remanescentes dos filhos de Tutankhamon, Ricardo Coração de Leão, René Descartes, sobre as relíquias de Luís IX, espalhadas pela França e falsamente atribuídas a Joana d'Arc, do suposto chefe d'Henri IV, e, em 2017, também participou das análises dos remanescentes de Hitler. Recebeu o prêmio e distinção da Academia Francesa, o prêmio Louis Pasteur, e da Academia Nacional de Medicina, prêmio Jean-Jacques Sorrignan, ambos em 2009. Ele organizou inúmeros eventos e exposições, e neste ano ele integra o Conselho Científico da Exposição Napoleão Já Não Existe, no Museu do Exército Invalides, investigando a real causa da morte de Napoleão I e analisando suas máscaras mortuárias com recurso e técnicas das ciências forenses. Participou de vários programas de TV, como Sagrados da História, na França, e vários documentários sobre análises osteológicas. Também é editor-chefe da revista Ethics, Medicine and Public Health, publicada pela Elsevier, e atua sobre questões éticas relativas a análises osteológicas na arqueologia e na antropologia forense. Welcome, Philippe. Thanks a lot for coming here today. Please, you can start your lecture.
Thanks a lot to you, and thanks for this invitation. I'm very glad to expose you and to present you my research and to try to explain all the audience how it's possible to work with forensics in various specialties of science, for example, history, anthropology, and also archaeology. So I propose to you to travel into time with many patients from history, these are some of the historical figures that were studied under my supervision during the past few years. You may maybe recognize Richard the Lionheart, Robespierre, Joan of Arc, Diane de Poitiers, René Descartes, Agnes Sorel, two French kings, Henry IV and Louis XVI, and Galileo Galilei. So I will try to explain to you how it's possible to work on such remains, and sometimes we don't have any remains, for example, for Galileo Galilei, but we have some historical mentions, some explanations about his health, especially his heart problems. So the first patient is Richard I, the King of England. His nickname in French is Richard Cœur de Lion, which means lion heart. He died in 1199 when coming back from a crusade, and he had a kind of hypertrophy of ego, something like megalomania, and he was fighting against the French people, but without any armor. He was naked, topless, if I can say, and he suffered an important wound because a fragment of arbalete touched his left shoulder, and he died not immediately, but probably 1 week, 10 days later. He had the time during this agony to order for his funerals, and he asked his bowels to be given to the French people. Something like, I give you my shit, you don't deserve anything else. Then he gave his heart to the Cathedral of Rouen, which was the capital of the English people in Normandy, in France. Then he asked his embalmed body to be deposed, to be inhumed in the family necropolis in Fontevraud. This is on the figure that you see now. This is what his tomb looks like. This is the heart tomb in the Cathedral of Rouen. As I said, he was just coming back from Jerusalem, from the Third Crusade, where he had liberated the Saint-Sepulchre with his former friend, then new enemy, Philippe Auguste. And this is exactly what we had to study. It's the heart reliquary. It's made of lead, and the inner part of the reliquary box is covered with silver, and what is readable on the surface is a kind of testimony. Hic jacet cor Ricardo Regis Anglorum. It's in Latin, of course. It means here is the heart of Richard, the King of England. The heart was, the reliquary of the heart were discovered in the 19th century. It has not been opened, not been desacralized before this time. And we studied it exactly like forensic remains, something like that we could find on a crime scene. We wanted to know if this was powder of heart, powder of a human heart, so we made some microscopic examination, some toxicology. We found at the microscope many pollens of myrtle, of daisy, of mint, and maybe also a lot of incense, a mix of mercury and chaux vive. It's a kind of preparation made from calcar, which dehydrate very quickly all remains made of fresh meat, for example, fresh organic remains. All of this embalming process was reconstructed step by step by this use of plants, of incense, of metal, for example, mercury, and this chaux vive, which is something which attacks the tissues and dehydrates them very, very quickly, as I said. The use of incense was absolutely amazing at this period, because at the end of the 12th century, no one human used incense for itself. It was especially and absolutely only devoted to the Christ in church or cathedral, but nothing for human. It was really 100% devoted to the Christ, because it was used for the embalming of the Christ by Joseph d'Arimathie. But in this case, the family had a strong necessity of using incense, because when Richard the Lionheart died, he didn't die easily, if I can say, because he was bisexual and because he had killed many Christians during the Third Crusade. The Archbishop of Rochester told that he will not go directly to the heaven, but he had to spend 33 years in purgatory. So his family and all the familiars, the relatives, asked for a kind of artificial smell of sanctity. And what is on this diaporama, in this slide, it's exactly the recipe of an artificial smell of sanctity. It's made of myrtle, mint, and daisy. It's made of incense, and also you have to add something to dehydrate quickly the remains. If you don't do it, of course, it smells something horrible, which is decomposition and putrefaction. So this was the first study, scientific but also historical and archaeological study, of a smell of sanctity, an artificial one, but maybe now Richard the Lionheart is well arrived in heaven. We will see later. The second historical personage I would like to speak with you is Saint Louis. It's a French king, Louis IX, and he died, as many people know, in Tunis, so in northern Africa, in 1270. He died of a sudden ill, which was an epidemic. He was not alone to die. Many people around him died, but during a long period, people said that he was dying of plague, but it was a false, wrong translation. He died of an infection, une pestilence in Old French, not peste, which is plague. So this error in the translation made that people always speak about the plague of St. Louis, but it's a wrong diagnostic, wrong retrospective diagnosis. Again, as for Richard the Lionheart, St. Louis, which was at this period Louis, only Louis, asked for a fragmentation of his body. The heart in a place, the viscera, bowels, all parts of the inner body were placed in the Sicily, in the royaume of his brother, Charles d'Anjou, and the rest of the body. All people tried to conserve it, but it was not possible. They put it in wine, but the body of Louis was in putrefaction, and it turned wine into an acid, something which is like vinegar. So they put the body out and out of the barrel, and they put it in spirit of wine, esprit de vin in Old French, something like I don't know, maybe whiskey or cognac, okay? But again, it made turn this kind of cognac, which was cognac with putrefied meat inside. So they put the body of St. Louis out and they cooked it like ossobuco. So they put it in this transformation was made by a cooker, and with spices, with pepper, with salt, and maybe many plants. He was cooked, literally cooked, and all the flesh was put out, and the dried bones were taken out of this culinary preparation, deposed in a box, and then they were transferred to France, inhumed in the necropolis of Saint-Denis, and it was reopened 30 years later by his great son, because the great son made his grandfather, Louis, turn into Saint Louis after canonization. So what we studied, it was not the bones, it was parts of the body, like a puzzle, okay? And we tried to recompose the puzzle piece after piece. It's exactly like on a crime scene when after an explosion, for example, or after a fragmentation of the body by the criminal, you've got the head here, the feet here, the heart here, and you have to recompose the puzzle. Same problem, same methodology, and very interesting results, I hope. These are the first remains that we studied. These are the fragments of the heart, of the viscera of St. Louis. They are conserved in the Cathedral of Versailles, which is Cathedral St. Louis. Just to imagine, it's a little socket of silk, white silk, written on it. It's written, these are the remains of the bowels of St. Louis, King of France. And you've got a seal by the Archbishop of Versailles. Inside, you can find two important fragments of 2 centimeter maximal length. You don't have the smell of it. It smells, how can I explain it? It smells like the 1st of January, you see, when you enter into the kitchen after a big fest, when you have eaten a lot, cooked a lot. So it smells like in a kitchen after an important meal, but a long time after, when you did not change the air in the room, okay? It's a little oxided, it's a little changed, the smell. It's not a fresh smell. This is exactly what it smells. Why? Because remember, it was the inner part of the body which has been cooked, which has been prepared by a cooker. So inside, when we examined it with a microscope, we found, of course, fragments of the body, but also fragments of vegetables and alimentation things coming from the inner part of the bowels, but also coming from outside during the embalming process. We also identified some parasites, like this one, which is Cystosomium hematobium, and we also studied other parts of the body, such as bone remains. This is the mandibula of St. Louis, which is conserved in the Cathedral of Notre Dame. It was not injured during the fire, the recent fire. And this mandibule is really interesting because we can make some morphology in it and also some retrospective diagnosis. For example, on the right anterior part of the teeth, you can find and see directly on this slide a kind of inflammation and resorption of the bone. This is directly devoted to scurvy associated with infection. So inflammation due to the deficiency in vitamin C plus infection, local infection, okay? We also wanted to confirm that the mandible was authentic, so we did carbon dating, and the carbon dating was absolutely compatible with the date of death of St. Louis, 1270, and also we did some morphology. We performed a CT scan of the mandible, which gave us a 3-dimensional reconstruction, a virtual one, of the mandible, and we put it on one of the statues which is considered as the most realistic one of the king. It's conserved in a little church in Normandy, which is Manville. So we put it in 3 dimensions, not just 2 dimensions, but 3 dimensions, and we saw that when we move the image, it gives a perfect fitting, anatomical fitting, a perfect anatomical superposition of all the structures. This is really an important fact, which is a strong application of forensic methodology for historical figures. You see? Another bone that was studied, it comes from in the center of France, in Prud'Homas, in the department of Lot. This is the reliquary of the right arm of St. Louis. But when we did the CT scan, we did not open it for conservation purpose. We saw that this is not the right arm, it's the left femur. It does not mean that it's not authentic, because during the consecration of all these relics made by the great son of St. Louis, he did not know exactly the exact anatomy. You have to imagine it like a student of medicine in his first year, for example, or maybe just a student in another kind of specialization. So the knowledge in anatomy was very poor. So we cannot exclude the fact that this left femur, which is partial, was strongly and truly the one of St. Louis. We did not open, we didn't make genetic analysis or carbon dating or many other examinations. So we cannot exclude this authenticity. But it's always interesting to see that what is what is depicted outside on the reliquary does not always correspond to what is inside the box. It's like for New Wave or for the end of the year, when you offer some gift to the children, they expect something outside, but sometimes when they open the box, it's not the gift that they want. It's the same for us, archaeologists and forensics. So we are still searching exactly what was the exact cause of death for the king. From the viscera that you saw before, we are trying to extract using paleo DNA, Shigella, Escherichia coli, Amebiasis, which is Entamoeba ostalitica, and we try to extract the DNA of such parasites or bacteria and even viruses. So we are still trying to extract them, but it's complicated because of problems of contamination which could be modern, but also contamination at this period due to the embalming process. So it's a long work, and for the moment, we don't have still the results. Another patient that probably you know is the man of Tolund. This man, which is absolutely well conserved, some living patients are less well conserved. This one dates from the Iron Age and comes from Denmark. It was discovered, it's a pit body, so it was discovered in pit, and probably the local conditions, pH, which is very acid, and the absolute humidity were very good agents for the well conservation of the body during centuries and centuries. When you see from a radiographic point of view the inner part of the body, you can see that there is a little shrinking of the inner organs. For example, the brain, which is shrunken a little, on this flocconous aspect of the bone, because it's so acid that the skin and the organic tissues are well conserved, but the bones are slowly decalcified. So this explains this kind of vaporous, cloudy aspect of the bones. What we studied in this body was especially the feet. So we put the feet in boxes. These boxes took the plane from Denmark to France, to Paris, and then we performed a micro CT scanner. When you do a scanner at the hospital, you've got the maximum definition of the pixel is 1 millimeter. When you do a micro CT scan, the maximum definition of the pixel is 6 micrometer. So it's really like a microscopic examination. At the difference that you do not cut, you do not destroy. It's still perfectly well conserved after your examination. So what we did is exactly this. We did the micro CT scan, and you can see on these both images signs of osteoarthritis, arthrosis, and also some signs of arteriosclerosis. What is highlighted in red on this image are the deposits, but the inner deposits at the level of the intima in this artery. Just to say that this man, which was probably 55 or maybe 60 years old at the moment of his death, had some deposits at the level of his arteries. And you can see the extreme well-preserved parts of soft tissues, such as muscular sheet and articulations, etc. It's really like a living patient. It's so well conserved that you can still have the plantar prints of this individual and also some scars. These scars, which it looks like a hurt, was due to the fact that he probably walked without some shoes one day and he had this scar. And we also saw some warts. Warts are a kind of infectious disease due to a virus, papillomavirus, and it gives this aspect that I frequently saw when I was a medical practitioner on living patients. Okay, so we did not extract the DNA of the virus because it was not possible to do so because of the acid pH of this environment. So we already knew that we would not get any DNA for this individual. It's already totally destroyed. So morphology in itself is sufficient to put the diagnosis of warts due to such a virus. It may be nothing, but these are the oldest warts known for humanity. Another patient, if you still want, this is Diane de Poitiers. Diane de Poitiers belongs to a very strong tradition for French leader. French leaders have their wife and a lot of mistress. It's really a French tradition, and you can have still, I would not say now, but maybe the one before our actual president, and it's really common. Okay, and what is interesting is that such mistress had a very social importance. Diane de Poitiers was probably much more important than the official wife of the French king Henry II. She had many castles. She had importance for the arts, for literature, for sculpture, for painting, etc. Unfortunately, she was between 10 and 15 years. She was 10 years older than her king and lover. So she had to take many drugs and preparations to, how can I say, to be cool and to be efficient in bed. Okay, I don't give you more details, but you have to imagine that at this period it was important. Okay, so we knew that she took what was called at the period or potable, aurum potabili. It's really a mix of medicine, apothecary, and alchemy. Currently, you took a ring, a gold ring, you put it in water, then you put it out of the water, and you drink the water. So the water is fulfilled with a kind of magic coming from gold. It's something like homeopathy, okay? But you expect that the inalterable character of gold will go inside the water, then you will take it inside of your body, and you will get you too absolutely inalterable. You will be like the sun. It's really something which at the mix of alchemy, medicine, and apothecary, so pharmacy. The problem is that Diane de Poitiers did not took something which was the spirit of gold, but a true preparation of gold, and this is particularly toxic. So when she did all the complications of this chronic intoxication in gold, she asked her to take more gold. So this, year after year, finished by killing her. She died of one because she wanted to stay fresh for a very long time. It was something like a fatal alchemy, you see. So what did we study from this body? First of all, I have to tell you that she died at 60 years old in 1566, just to fix it in chronology. When she died, she was embalmed by a famous French surgeon, which was Ambroise Paré, and she was deposed in a mausoleum. But during the French Revolution, the revolutionists took the body out of the coffin and presented it outside for 2, 3, 4 days. After 4 days, it began to smell bad odor, so it was put directly in the mass grave, and no one other skeleton or body was put in this mass grave after it, just in memory of her. Some years ago, we reopened the mass grave and we found the body of Diane de Poitiers exploded like a mikado. The heart here, not the heart, the skull here, the femur here, the humerus here, because the body, which was in strong putrefaction at this moment, exploded when it touched the ground, and it was dismembered from one part to the other part of the mass grave. So this is what it looked like during the archaeological excavation. What I'm holding in my hand is the mandibula of Diane de Poitiers, and we were able to reconstruct many parts of the body and to make some retrospective diagnosis, mainly osteoarthritis. You have to remember that she died at 60 years old, and she was very sportive. She did a lot of sport, like swimming, like horse riding, and we saw also some consequences of the chronic gold intoxication, such as many antemortem, so premortem, before death, tooth loss. See, she only had 4 remaining teeth at the level of the mandible and not a lot on the upper side. We also diagnosed a trauma, an old fracture, probably 1 year old, 1 year before her death, at the level of one leg. So it touched the tibia and the fibula, but it was absolutely and totally healed at the moment of death. Why? Again, because she was cured by Ambroise Paré, the famous French surgeon I spoke just before, the one that embalmed her some year later, and he asked for her to not to let pus arriving at the level of the trauma. He made cleaning day after day, and he prevented any infection at this level by adding some copper in this and some organic preparation, such as vegetables, etc. And before pus did not arrive here, she did not made any local infection like osteomyelitis, like osteitis, like later septicemia, and she survived this trauma, which could have killed her without such a good healing and cure by Ambroise Paré. So this is the CT scan, the medical one, of the full body, and you can see that we don't have many parts of the body because of this explosion of the cadaver at the moment of his deposit in the mass grave. This is an illustration by Ambroise Paré of the healing of such a trauma. And you can see that the wound is left open, widely open, in order to clean it day after day and prevent any local infection. To be honest, Ambroise Paré was really a good one. And he was one of the most influential and innovative surgeon of this period, probably the creator of modern surgery for the Occident, especially in France. And to testify, I was much more moved by having a bone that was cured by Ambroise Paré than because the bone was the one of Diane de Poitiers. You see, maybe it's the doctor speaking, but it was a relic of Ambroise Paré rather than a relic of Diane de Poitiers. End of the parenthesis. Just wanted to tell you my feeling. Another anatomical preparation, which was particularly interesting for us, both from a forensic and also historical and anthropological point of view. This is the oldest conserved human dissection for Western Europe. It dates back from the 3rd century after Deus, of course, and we are at the early origin of medieval anatomy. You see it, but again, you don't have the smell. I work a lot with my nose, and not only my nose, but also professional noses from Guerlain, Sylvaine de la Courte, for example, which is the nose of this great parfumer, and she makes perfumes. And also another friend of me, which is Jean-Michel Durier, which works from Jean Patou, Rochas, and is also a famous nose. And I ask them, each time I work on a historical figure, but also in the museum where I work, which is the Musée du quai Branly Jacques Chirac in Paris, I ask them to smell fetishes, statues, mummies, brains, hearts, human remains, etc. And they smell them and they are able to tell me, for example, for Richard the Lionheart, I said previously that he was embalmed with incense, but these nose tell me it's white incense from northern Yemen. So they are absolutely precise, just not a big category, but they are very, very precise. And you can imagine how important it is just for the initial characterization. And later, of course, we do further examination, for example, molecular nose or elementary analysis or toxicology, which are much precise, but we need the first examination to go in one direction. So they smell this one, and you have to imagine something. I don't know if it exists in Brazil, because I don't know Brazil yet, but I will know one day, of course. But something like smoked salmon or smoked pork. Does it exist? Yes? You have it? Good. It's exactly this kind of smell here, because this body was conserved using mercury. You will see it later, but also it was smoked, and it's very good kind of conservation for human body. When we did the preliminary examination of these anatomical piece using radiograph, this is exactly what we saw. All the arteries are fulfilled with a dense material. It's like a living patient when you do arteriography or angio CT scan or angio MRI. You've got exactly this kind of highlighting of the arteries, and later you've got the veins. Here we don't have the veins, just the arteries. We wanted to know why, because of course no radiology in such an ancient period, medieval times. It was, I think, for the conservation of the body, first of all, but also for the highlighting using this very red and intense color preparation to highlight when the body was cut for anatomical presentation to students or professors, just to highlight the arterial structures. You see them much easily this way. So the composition of this inner part of the filling was wax from beeswax, cinnabar, which is sulfur of mercury, and also castle earth, which is preparation made of amorph carbon. It was used a lot by all the painters at this period, especially in the northern part of Europe, what we call les peintres flamands, Van der Weyden, for example, and Memling, Hans Memling. So this preparation was interesting because, again, it was a mix between art and also science, anatomy. We did some anthropology for this individual, and we saw that he was reasonably a male, we suppose a male from the bone, but we know that it was a male because of barb and mustache, which is very well present. We did also some genetic analysis, and the genetic analysis showed that he was indeed a male one coming from Northern Europe. When we do the genetic analysis of geography and ethnic origin, we saw that. But what was the most amazing was the carbon dating with this datation from the early period of medieval time. And this is, for us, the most ancient human preparation. And the anatomist wanted to study, I think, the nose, the left eye, and also the inner part of the cranial box. What you can see inside the skull, it's not the brain, it's the dura mater, the dura mater, which looks like a mushroom, something like this, but the brain has been totally extracted. And the anatomical researcher wanted also to study, I think, the thyroid, because the anterior part of the neck was opened and the thyroid has been extracted at this level. CT scans are really important for us. We don't perform any other historical or anthropological or archaeological examination without any preliminary CT scan. And here, CT scan is really interesting for us because it permits us to reconstruct some organs that are no more present. For example, this brain, the brain on this slide, is the brain of the French king, Henry IV. But you will see what the brain looks like now. It's just 1 centimeter thickness, nothing else, in just a little part of the skull. How do we do it? Here is the mummified head of the French king, Henry IV. We extract totally all the organic tissues. We just conserve the bone, because all the organic tissues may be deformed or altered by the embalming process. So we just conserve, after the CT scan image process, we just conserve the bone. This is one cut, a sagittal cut of the head of the French king. You can see osteoarthritis at the level of all the vertebral the cervical vertebra. You can see also the inner part of the mouth with the tongue, which is retracted. And what you can see inside the brain is the dura mater, like spider formations, and also the brain, which is totally dehydrated at the level of the occipital bone. What we do is that we extract totally all the bone, and we just conserve the surface of the hair filling the inner part of the skull. So it's like an endocast, it's like a cast, a print of the inner part of the skull, which represents exactly a molding of the surface of the brain. It's really important for us because we can perform some retrospective diagnosis, some neuroanatomy. We can see the circumvolutions, we can see the vascularization, we can see also the segmentation of all the different parts. Of course, we don't know the functional activity of this individual, but we can see anyway if there is any asymmetry in the vascularization, in the organization of all the circumvolutions, and this is interesting. It's absolutely not phrenology, which is a fake science, but we do neuroanatomy. For example, after a stroke, with the patient does not die just after, but survive, we can see something like a scar, like the local absence or a clarification of the surface of the brain. CT scan is also very interesting for us when we try to determine if one remain is authentic or not. And we studied especially 2 individuals. The first one is Carême. Carême was a big chief, culinary chief of France. He was at the service of the Emperor Napoleon, which is very famous, of course, the Tsar Alexander of Russia. And he finished his service, if I can say, serving the Rothschild family, which is one of the most rich family of France at this period. He died young, at 50 years old in 1833, because he was a chief, initially a pastry chief. So he wanted to test everything that he was preparing for the family and for the people that he was working for. So he had what we call polycaries, so more than 2 caries on each of his teeth. And just after, of course, without any extraction of these teeth, the infection came to the adjacent bone, then to the face, then to the inner part of the brain, which means meningitis, acute one, then encephalitis, then death. So it was like a professional disease that turned into a professional death. He died of pastry, just of pastry. He was considered at this period as a genius one. And you have to know that in 1833, we are exactly at the period of phrenology. So there was a cult of skulls. All the skulls of famous people were conserved. At this period also, some facial masks were carried out to conserve the face aspect, but also the head surface of these individuals. We were not sure that the skull was authentic or that the facial mask was authentic. So we did a CT scan of both of them. And we made, using a computer, we made a 3-dimensional superposition of one on the other. So we used this superposition in a number of points, which is absolute, which is infinite, because we work on curves. And you can see that in all the anatomical surface, we've got a strong superposition of all the points. This is for us as strong as an identification process for forensic purposes. We did exactly the same with the head of Henri IV, because some journalists said that this head was not the one of the French king because it was not sewed, the head was not opened to extract the brain as it was made for many, but not all, of other French kings. Anyway, we did the same technique. So we took the head, you know it now because you saw the brain, which was constructed from the inner part of the head, and we superposed, using the same CT scan, all the anatomical surface of the facial mask taken from the cadaver of Henri IV just after his death in 1610 in Paris. This is the result, and you can see that again in all the positions on all the anatomical structures, we've got a 3-dimensional perfect superposition of one over the other. So it's really perfect matching of anatomical surface. This is again an absolute testimony of the use of forensic techniques for the identification of past leader human remains. Facial masks are really interesting for us. On this example, published in the Lancet, we studied the facial mask and also the medical testimonies dealing with another French historical figure, which is Robespierre, Maximilien de Robespierre, a French revolutionist, a lawyer from the northern France. And we were able to make a proposal, just from a pure medical point of view, of diffuse sarcoidosis for him, because he had many clinical signs. No one was visible from the facial mask or from the remains, because we don't have any more remains. The body, we don't know exactly where it is for the moment. It's considered lost. But we have these facial masks, and even the facial mask, we are not sure that this facial mask is authentic. Anyway, we proposed on this dubious facial mask a reconstitution of this human figure, and you can see on it that he has strong scars of smallpox and also important scar of lesions of sarcoidosis at the level of the base of the nose. This is just an illustration, but the medical diagnosis proposal is based upon the medical file of this patient that we found in the archives of his personal physician, which are conserved in Paris. We wanted to go further. He was injured one day before his beheading by the guillotine, and he was laid down on this beautiful piece of ebenistery, which has been conserved. And there is a blackish pigmentation at the level of the cover of this office. And we wanted to extract it because it was supposed to be the blood of Maximilien de Robespierre. Unfortunately, for the moment, it was impossible to confirm the fact that this is human blood. We don't have the techniques, for example, to extract it and to make the difference, to make the point between other past DNA. There is too much contamination. So for the moment, we do not know. So I give you a rendezvous in 10 years, maybe, and maybe I will be able in 10 years to give you the result of such an exam. You can see here the facial mask of Robespierre. And when we did the three-dimensional surface scan, we were able to find on it, but again, I insist, we are not sure that this facial mask is truly the one of Robespierre. Anyway, we were able to find many scars of smallpox, 59 on the right side and 83 on the left and upper side of the face. So it's really like the surface of the moon. It's a strong disfiguration of the face of this individual. And this is the reconstruction that we proposed for this individual. Some people did not agree for a doubt regarding the authenticity of the mask. This is totally acceptable. We are not sure of it. Some others told us that this face is a problem because we are trying to not to bless, sorry, this is not a good word, because we are trying to attack the tradition of the French Revolution. We are trying to mock this historical figure, which is absolutely not our goal. We just and only try to be realistic, to do the job without any sensationalism, without any political reason or organization. We are just objective, and we only consider Robespierre, as Richard the Lionheart, as Saint Louis, and many others, as patients from history. And we just are their new or last physician, medical doctors, nothing else. So we do not judge them. But we have to know, and you have to know, that all these facial reconstructions, all these diagnoses may be judged by historians. This is normal, and we work with historians day after day. But it may be judged and considered against one part of the history by politicians. And this is really the risk, because these images are the remains of our work. These are all the patients and the kind of philosophy that I wanted to share with you tonight. And I hope you enjoyed. Of course, if you want to ask some questions, you may ask Camilla and others from the team to forward them to me. Thanks a lot.
Thank you very much. It was a great exposition.
Yeah, thank you, Philippe, for the lecture. I think everybody enjoyed, and it was a very funny, actually, and very interesting subject.
I just do hope that the English was sufficient, because I'm not practicing English very well, and I've got a huge French accent, and my vocabulary is very poor. So I apologize for this. Sorry.
It was great. I understand perfectly. Yeah. Thank you.
Yes, it was perfect. Thank you very much.
I hope you come to Brazil soon.
I do hope so. I do hope
Yeah.
so. Soon, I don't know, but one day, and if I do go to Brazil, it will be for you and with you anyway. So you can consider it anyway. Yes, yes.
Thank you very much.
Exactly.
Yeah.
But what is important is that fundamental science, for example, bioarchaeology or biological medicine, is not working alone. We are always working and never fighting against archaeologists, anthropologists, historians of art, ethnologists, historians of religions, etc. It's not one against the other. We are always sharing all our data, all our techniques, etc. So this is really the most important message of this presentation. We work together. It's not science that helps or enlightens history. No. We are working together at the same level of speciality and development.
Perfect. Yeah. It's always a dialogue.
Exactly.
Thank you.
Thank you.